Hi, Cavan. How are you?
Hi, Ishu. How are you? As you know.
I'm doing well too. Very nice to be sitting with you and getting something to chat about that we're both very passionate,
Exactly.
and that's youth engagement. Um, as a young leader, as a youth leader, what do you think are some of the ways where you feel that you've gained success in getting the voices of people living with NCDs or young people heard at the global forums or even at the community level where you want to influence some change?
Okay, so my work so far has been to empower young people to take action towards, non-communicable diseases and also mental health. Because what I capitalize more on is the fact that non-communicable diseases does not necessarily only has to do with the physical conditions, but also take into account mental health, which is what I'm mostly passionate about and what I advocate more about. Is more attention towards mental health challenges and prioritizing mental health strategies for young people.
That's fantastic because I remember that I was running a workshop many years ago for young people in ASEAN countries. And we were in Indonesia. And one of the things that struck me that a lot of people who wanted to engage at the community level wanted to work on mental health because they felt that that was such an important issue that the young people were facing, but there was no voice to the issue. So they wanted to bring that to the forefront because they were not only people who were living with mental health conditions, but really wanted to also help people around them who thought that it was stigmatized, it was shame to talk about your own mental health.
Yeah, I think that persons who actually live with NCDs can give real life experiences as to how they are, coping with the NCDs, and they can actually implement policies that will shape how, government and different organizations tackle the issue of, rectifying the problem of NCDs. And I mean, I've had experiences over time dealing with or encountering people who have, issues with mental health as well. And, my own personal life experiences with persons who actually have, heart disease, stroke, and cancer. I have experienced even students. I currently attend the University of the West Indies, and there are students at the campus that, they have like different episodes and they have like unfortunate circumstances where they too suffer from non-communicable diseases as well. Not just mental health, but also the physical conditions as well. So it's really a major issue that a lot of persons are facing and in different parts of the world. So it really calls for an action to really, prioritize and rectify the issue, and create more solutions that can help everyone.
True. And I think one of the things that we need to really push for is that we need more financing and investment in mental health.
Right.
And I think that is very important because um, some a couple of years ago, I remember we did a study where we wanted to understand what was the mental health status of young people post COVID and if there was any stigma that they were facing relating to their weight. And one thing that we found, which probably is known, is that people who were overweight, who thought that they were overweight, had stigma, but there were people who were underweight, who classified themselves as underweight, also faced a lot of stigma. So there were issues that they were facing, which we were able to uncover while we were able to ask them. So I think one of the things that we have been also wanting to advocate for and have been trying through our research is how do you make mental health come more into the forefront and how do you push for more investment in mental health, especially for young people?
All right. I'm glad you brought up after COVID. Yeah. So, like giving my experience in Jamaica and working alongside, because I was national president for the National Secondary Students Council in Jamaica, which is a youth-led organization for young people. So we advocate for issues that are happening within the secondary school space. And after COVID, we realized that there was like a spike in how students were behaving, and there was like a different tone. Now the mental health issues became more prominent, and it became a more critical issue that we needed to rectify, because we've seen instances where there was violence in schools. There was an unfortunate instance where a child actually died because of the violence in the school. So, and this all took place after COVID. So we had to like assess what was the root causes of this, and realize that it was probably because they're away from school, and school was that institution where it keeps them grounded. They're not always at home, because the reality is that when you're at home, you're constantly experiencing a lot of struggles. A lot of parents are not present. There's a lot of issues within the home, issues with like family. So being around that can really affect a youth mental health. So, after they, were at home frequently and then they go back to school, it's as if they're still in, a different headspace. So they became more violent. And we, as in the National Secondary School in Sugo, what I did was to implement a mental health task force. I mean, along with other things, but I focused on the mental health task force because that was like, it was a major issue in Jamaica where like almost every week you heard of like an issue where there was violence in schools. So we had to come up with something. I would partner with like UNICEF and Jamaica Youth Advocacy Network and other organizations to really see how best we could manage the situation. It's still a challenge. It's still not rectified. We still have a long way to go.
Yeah.
But even the Ministry of Education started a campaign as well about no violence in schools. So it was a deep issue, but I don't know if you have like similar experiences in your country that you could share about how, childhood traumas and mental health issues affect students and how they retaliated towards it.
I think we also faced similar issues during that period of COVID when there was lockdown. I think one of the things that happened was the government took notice of it because it was not only young people, but there were also adults who were getting affected by the constant lockdown, not being able to meet anyone. There was no socialization happening. They were not even going to offices or children going to school. So I think one of the things that they did start a helpline that you could talk to, and it was connected with a lot of mental health counselors. So what you could do is you could call that number, and it was a toll-free helpline, and you could talk to them but get support in terms of how the issues that you're facing. So if they felt that you needed a referral or you needed to see a specialist, they would actually guide you on how to see. So it was sort of a navigation mechanism as well. But one thing that interests me, and I would want to ask you, Cavan, is that you said that you engaged while you were doing that program with a lot of other key stakeholders,
Right.
UNICEF and some things that the Department of Education also did, why you established that task force. I want to just hear about how did that experience go of engaging stakeholders, how easy it was, how difficult it was for you.
Right. I mean, I think it depends on the stakeholders that we were interacting with. So UNICEF is one of those organizations that we're grateful for because they actually invest in youth-led initiatives and they show that they're actually really, interested in actually bringing apart like change and, contributing to the different initiatives that young people have. So they even came up with the Mental Health Summit and where they were participating, sharing our opinion, sharing our perspective as to what we are experiencing as young people. And the Ministry of Education, I would say overall, different organizations or different stakeholders that we engage with give some level of, contribution to our efforts. However, there's still a long way to go. There's still a lot of inefficiencies as to how we're getting the necessary resources. Especially in Jamaica, if you look at the resources that we currently have, it is very lacking. But I can say for UNICEF exactly, they've established, similar to what you just said, the chat line, they've actually established a chat line for mental health. So young persons are able to go and, if they're having any certain episode, they can, call and interact with somebody. But as I said, there's still a long way to go. There's still limited resources. So what I would say that, based on the stakeholders that we have at our hand, there's still more that they can do to invest in, mental health and creating a robust level of resources that we can use. There's still a limited level of like psychologists and psychologists that are in Jamaica. So is it a similar thing for you?
It's same, and I think I've
Yeah.
seen for a lot of low and middle income countries similar thing, that they are so under resourced and so understaffed for the mental health professional, considering the scale of the problem that exists. So
Right.
there would be a lot of people that have issues, including young people, but one, they either don't know that they have services available, and if they go, there are not any specialists to see. So I think my key focus would be that I would really want to see the national governments take up the issue of mental health seriously by investing in mental health. And when you invest in mental health, you will be able to strengthen the whole health ecosystem where young people can go access services, including getting aware. Yeah.
Exactly. And I mean, there's some level of solutions that we can develop as young people to make sure that we're driving change and actually holding these government and organization accountable. So a lot of times I would like say that we need to build more correlations among young people. So going youth groups, building, organization, creating that unity and that level of, strength as one body to make sure that whenever you're approaching the government about certain issues, that you have a strong network and a strong team behind you. Also tell them to, engage in more dialogue. So have forums similar to like forums that we have for the NCD Alliance Forum, and where young people are present and young people are sharing their experiences. We need to have forums and also town halls where, you have the persons there, the government officials there, and we can ask them serious questions and, ask them for specific actions that we want to see to change the narrative or their trajectory regarding mental health. So there's a lot that we can do. So my key ask for organization and stakeholders that are interacting with young people is to not just have them as, participants in the whole decision-making process, but also as decision makers, because young people have the skills and unique abilities to actually enact real change. So we want to be not just at the table, but also at, the decision-making meetings where, you're implementing them in different policies and etc. So that's my key ask. We don't necessarily just want to be present, but we also want to make positive impact.
Thanks, Kevin. It was wonderful interacting with you, catching up with you. And I think what we have pointed out is that investment and meaningful engagement of young people is what we need. So it is the time to lead.
Thank you.